Hello everyone, we are from Group 1 and today we are going to present to you about the treatment drugs for glaucoma patients. This is our group member that contribute a lot of information for this presentation. Okay, let's start. What is glaucoma and can it be treated?
Glaucoma is a serious eye condition that affects the optic nerve, often caused by increased pressure within the eye. It is one of the leading causes of blindness worldwide, with many individuals unaware of the damage until significant vision loss occurs. Since glaucoma typically develops slowly and without symptom in its early stages, it is often referred to as the silent thief of sight. Early detection and treatment are crucial to manage the disease and preventing irreversible vision loss. There is no cure for glaucoma, but it can be treated effectively, particularly with medication aimed at lowering eye pressure. Among the most common treatments are eye drops, which help reduce IOP and prevent further damage to the optic nerve. Two types of eye drops commonly prescribed for glaucoma are alpha-adrenergic agonists and beta blockers.
Okay, the drug's description for alpha-adrenergic agonist is to reduce intraocular pressure, or known as IOP, by decreasing aqueous humor production and increase the uveoscleral outflow. Also, the drugs that commonly prescribed is brimonidine, or known as alphagan P. It has selective alpha to adrenergic receptor agonist. And also, we prescribe apraclonidine, or known as iopidine, which has non-selective alpha adrenergic receptor agonist, primarily used to manage acute IOP spikes. Meanwhile, for beta blockers, description is to reduce aqueous humor production by lowering the intraocular pressure, or we known as IOP, and it is often being used as second-line therapy or in combination with other drugs. The drugs that commonly prescribed is timolol, or known as Teraputik, or betimolol. It has non-selective beta blocker that blocks both beta 1 and beta 2 adrenergic receptors. And the other one is a betasolol, or known as Teraputik. It has selective beta 2 adrenergic blocker, which offers better safety profile for patients with respiratory issues.
Okay, next I will be continuing the description for the alpha-adrenergic agonist. So its advantages is its dual mechanism of action, and it has neuroprotective potential that may benefit optic nerve health. The dosage and administration. It is typically administered as eye drops 2 to 3 times a day. Next is the side effects. It has the side effects for local, systemic, and contraindicated side effects. So for the local, it will give redness, itching, dry eyes, or allergic conjunctivitis. Or for the apraclonidine. As next for the systemic effects, it will give fatigue, dizziness, dry mouth, and hypotension, which is quite rare. And lastly, the contraindicated, children under 2 years due to risk of severe systemic side effects includes CNS depression. As for the beta blockers, its advantages is the proven efficacy in reducing IOP by 20 to 25%. It is cost effective and widely available. For the dosage and administration, it is typically administered as eye drops 1 to 2 times daily. For the side effects, for local side effects, it will give dryness or irritation or corneal anesthesia. It will give systemic effects due to nasolacrimal absorption. First, cardiovascular, bradycardia, hypotension. For the respiratory, bronchospasm in non-selective agents, particularly. For the CNS, it will give fatigue and depression. The contraindication for the beta blockers is the patient who has asthma, COPD, especially non-selective agents like timolol, heart block, or severe heart failure. For the alpha-adrenergic agonist, its primary action is it reduces production and increases outflow. For the effectiveness, it moderates IOP reduction for 20 to 25%. The frequency of administration is 2 to 3 times daily. So the major side effect is it will give allergic conjunctivitis and systemic fatigue. So the best use cases for the neuroprotection, brimonidine, and acute IOP spikes. So for the beta blockers, its primary action is to reduce the aqueous humor production. Its effectiveness is moderate IOP reduction, 20 to 25%. The frequency of administration is 1 to 2 times daily, and its major side effects is respiratory and cardiovascular side effects. It is best used for adjunctive therapy, respiratory safe options.
Next is mechanism of action. Firstly, we start with alpha-adrenergic agonist, which is brimonidine. Brimonidine is an alpha-2 adrenergic agonist used to treat glaucoma and ocular hypertension, as well as facial erythema in rosacea. The mechanism of action is brimonidine is an alpha-2 adrenoreceptor agonist. As an ophthalmic agent, it works to reduce aqueous humor production and increase uvoscleral flow and lowering intraocular pressure, which is IOP. Topically, it reduces erythema through direct cutaneous vasoconstriction. The onset is rapid onset of action, ophthalmically, and the duration approximately 12 hours apart. Next is beta blockers, which is betazolol. Betazolol is a cardioselective beta-blocking agent commonly used to treat hypertension and elevated intraocular pressure when administered ophthalmically. Betazolol is a cardioselective beta-1 receptor blocker, which little to no effect on beta-2 receptor. It lacks intrinsic sympathomimetic activity and weak membrane stabilizing activity. It reduces aqueous humor production to reduce intraocular pressure, which is IOP. The onset is within 30 minutes ophthalmically or 1 to 1.5 hours orally. The duration is approximately 12 hours apart. After that, we go to indications. Firstly, alpha-adrenergic agonist. For brimonidine, an alpha-adrenergic agonist indicated for lowering intraocular pressure IOP in patients with open-angle glaucoma or ocular hypertension. For other example for alpha-adrenergic agonist, which is apraclonidine eye drops 0.5% are used short-term to treat glaucoma by lowering eye pressure in patients who still have elevated pressure despite other medication. The 1% version is used to prevent or reduce eye pressure during and after certain laser eye surgeries. It belongs to alpha-2 adrenergic agonist class and works by decreasing fluid production in the eye. Next is beta blockers. We start with betazolol. Betazolol eye drops is used alone or together with other medicine to treat increased pressure in the eye that is caused by open-angle glaucoma or a condition called ocular hypertension and secondary glaucoma. For other examples, such as timolol, ophthalmic timolol is indicated for the treatment of increased intraocular pressure in patients with ocular hypertension or open-angle glaucoma. The oral form of this drug is used to treat high blood pressure.
Side effect for alpha-adrenergic agonists. The first one is brimonidine. The common side effect for ocular is eye irritation or discomfort, dry eyes, redness or hyperemia, and allergic conjunctivitis, frequent with long-term use. For systemic side effect is fatigue and drowsiness due to CNS effect, dry mouth, and headache. Now, for the serious side effect for brimonidine is hypotension, bradycardia, which is rare, and depression or other CNS system effects, especially in elderly patients. Now, the second one is apraclonidine. The common side effect for ocular is eye irritation or burning, conjunctival blanching, lid retraction or mild ptosis. For systemic side effect, dry mouth and drowsiness. For apraclonidine, serious side effect is allergic reaction, as example like allergic conjunctivitis, particularly with prolonged use, tachyphylaxis, and systemic hypotension, which is rare. Now we move on to beta blocker side effect. The first one is betasolol. The common side effect for betasolol for ocular is eye irritation or discomfort, burning or stinging upon instillation, dry eyes, and blur vision. For systemic side effect, fatigue, bradycardia, and hypotension. Now for betasolol serious side effect for respiratory effect, example like mild bronchospasm and dizziness. For the second beta blocker, which is timolol, the common side effect for ocular is eye irritation or discomfort, burning or stinging upon instillation, dry eyes, and blur vision. For systemic side effect, bradycardia, hypotension, fatigue, and dizziness. For timolol serious side effect, for respiratory effect, they can have bronchospasm or shortness of breath. For cardiovascular effect, which is heart failure and arrhythmia. Last one, CNS, which is depression and sleep disturbance.